So let's talk about something else that's probably interfering with your sleep that a lot of people don't realize. This is something that people tell me about all the time, as often as yesterday whenever I was talking to a client. So one of the things that people often do that screw with their sleep is exercise. Now, let me say this differently. Whenever it comes to exercise, it is incredible for sleep, and it is going to be something that is fabulous. However, the timing in which you exercise is going to be absolutely key. You've probably heard me talk about in other videos that we have something called a sleep gate. And your sleep gate is basically 2 to 3 hours before your desired bedtime. That is a very important time in which we decide what things we do want to include in our sleep gate and things that we don't want to include in our sleep gate. So whenever it comes to exercise, we don't want to include that in our sleep gate. It's going to be detrimental for us to exercise too closely to bed. Now, why would that be a problem? Because I'm sure many people who are listening to this video right now think that I'll exercise right before bed because that's the only time that I have to do it. I'm busy, I work all day, and that's the only time that I get to myself to get on the Peloton or to go train for my Ironman, whatever the case may be. So let's talk about that then. Whenever it comes to exercising, especially whenever we're talking about moderate to vigorous exercise, what does your body do? Your heart rate goes up, your blood pressure goes up, you become very alert and engage in your surroundings. You are sweating probably, your internal body temperature is going up. Your body is releasing hormones of adrenaline and cortisol, which again are really amping you up. And for an exercise, that makes a lot of sense. However, whenever we are thinking about exercise and being very activated, the heart rate being up, our body temperature being up, our adrenaline and cortisol being up, that's a very different state compared to where we want to be for falling asleep. When we fall asleep, we want to be in this very relaxed, calm state. So if we go from trying to exercise right before bed and then trying to fall asleep, that's a big difference. And that is oftentimes why people have a hard time falling asleep, is because they have so far to go to get to this state of being sleepy and feeling like their body is ready to go to bed. Again, the way that we think about it is after an exercise session, especially moderate to vigorous, it is going to be the opposite state of what it is that we want to be whenever we're trying to wind down and we're trying to fall asleep. The other thing that we need to talk about is that there will be some people, and this happens to me all the time, there will be some people who break every single sleep rule that I'm going to talk about here on my channel. And with that, they sleep just fine. They sleep incredibly. And for those freaks out there, I salute you. You have won some type of sleep lottery, because for the rest of us, we do have to follow sleep rules, if you will. And this is an important one whenever it comes to exercising, because our physiology is going to be so incredibly worked up. Even though it may seem like it takes you only a little while, maybe 20 minutes to get back to your baseline, it actually takes much longer for your physiology to truly come back down to baseline. So that's why I'm recommending to do your exercise earlier in the daytime rather than in that window of our sleep gate, which is 2 to 3 hours before bed. If you have the luxury of being able to pick and choose when you exercise, I'm going to give you some tips. The best possible time for you to exercise is early in the morning. You may have heard this before, but if you can exercise outside, that's even better. You're getting fresh air. But also, one of the things that you can do to strengthen your circadian rhythm is whenever the sun is at a low angle in the sky, so it's still on the rise, and you are outside exercising and you're not wearing sunglasses, you're looking toward the sun, but you're not burning your retinas, that is going to be the best possible time to exercise, because you're getting this benefit of exercising and you're getting the benefit of being outside and getting some fresh air. But also when the sun is rising and we're outside and we're able to naturally look at the sun, then that is going into our eyes, into our retinas, back to the suprachiasmatic nucleus, to the pineal gland, and it's letting the brain know this is time for us to be awake. The sun is up. And so it's helping give our circadian rhythm some information as to what's going on, where the sun is, because like we've talked about in other videos, even though we are very far past our caveman ancestor days, our brains are still wired in this very ancient way to be in tune with the sun and to be awake when the sun is up and to start to feel sleepy when the sun goes down. And so if you can be outside and do your exercise in the early morning when the sun is at a low angle, that's going to be excellent for your circadian rhythm. I want to talk about why exercise is amazing for sleep, because it absolutely is when it is done at the proper timing. And If you can't do exercise in the early morning, that's not to say like nothing or bust. Exercise will still be very beneficial for you in the daytime, even into the early afternoon. It's really when we're getting to that 2 to 3 hours before bedtime is whenever we start to encroach on territory where the exercise then starts to be less beneficial and more counterproductive. So let's talk about why exercise is so incredibly important and fantastic for sleep. So when we are having this regular exercise, it can help us fall asleep faster. It can help us sleep more soundly, and it can help us sleep more deeply too. And deep sleep is going to be very, very important. So this is something that we've talked about here on the channel, is that you have various different stages of sleep that you are going to be cycling through each night. And that'll be light sleep, deep sleep, and REM sleep. Deep sleep is super important. All of them are important, but deep sleep is very important whenever it comes to physical recovery. So whenever it comes to deep sleep, remember, we're asking our body to work very hard all day, every day, and especially whenever it comes to exercise and whatever type of exercise we're doing, that we inevitably have micro wear and tear and damage that happens to our muscles and our tissues and our cells. So when we are getting the chance to get into deep sleep, then our body has the opportunity to go in and to kind of be this nightly maintenance crew where they go in and they fix any micro wear and tear and damage that's happened. And so then our energy reserves are also restored for the next day, so we're up and we're ready to go. Now, something else that happens with exercise is it helps increase adenosine. Adenosine in this circumstance, and increasing it is a good thing because adenosine is one of the things that help us feel sleepy. Adenosine is also called our sleep drive. So whenever you wake up after a full night's rest, your adenosine should be very low. All day long, the adenosine builds up and up and up and up until it gets to a point where it's quite high, and that's what makes you feel sleepy. So it builds up all day long to a point where it's quite high and it makes you feel sleepy. That's what adenosine does. If we're exercising, we can build up even a little bit more adenosine, and this is fantastic, especially for those of you who have a hard time falling asleep. Adenosine is going to help us feel sleepy, and it's going to help us fall asleep faster. So those are excellent things. Something else, whenever we're exercising throughout the day, our adenosine is up high, we're also going to have less awakenings throughout the night, which is going to be really important. Now, one thing that you'll hear me say is that it's not unusual to be awake in the middle of the night, especially a very brief period. Maybe you get up, you get another blanket, you throw off your pillow, you do a couple of different things, maybe you get up and go to the bathroom, but nonetheless, you should be able to fall asleep very quickly. Now, if you're awake in the middle of the night for extended periods of time, longer than 15 to 20 minutes, now this is an issue, and we'll talk about it in another video here. But what we want to do is to decrease the amount of awakenings that we have as much as possible. And that's one thing that exercise will do for us. If you're someone who already knows that you have a sleep disorder, say for example, insomnia, exercise is going to be an excellent way to help you. Because oftentimes when people have insomnia, it looks like a couple of different things, but oftentimes it looks like having a hard time falling asleep. So exercise, especially earlier in the daytime, will help you be able to fall asleep more quickly. Exercise can also be really useful for folks who have obstructive sleep apnea because exercise is going to help strengthen the respiratory system, and that's going to be important for folks who have obstructive sleep apnea. So I know that having time to exercise is a luxury in and of itself. I get that, but I want to give you this information because I want you to know when is the best possible time to be able to schedule exercise into your daytime. Let's recap about what we talked about here today. Exercise is fantastic for sleep, but the timing in which you do it is very, very important. So if we're exercising too close to bed, remember all the things that our body does when we exercise. Our heart rate goes up, our blood pressure goes up, our internal body temperature. We're releasing cortisol and adrenaline, and we're sweating. Lots of things are happening, and that is often a state that is very, very high up here, when sleep is a state that's very low down here. It is relaxed, it is calm, and so our body takes time to come back down to this place of rest and relaxation where we can actually fall asleep. So when we're exercising too close to bed, and when I say too close to bed, I mean 2 to 3 hours before bed, that's when we're kind of working against our ability, and we're kind of at two different states. So what we can do is we can change the time in which we exercise. Hopefully that's something that you can work into your schedule. And what that might look like would be exercising earlier in the daytime. If you want bonus points, do it outside and do it in the early morning whenever the sun is at a low angle. That's going to be the best bet. And the reasons why exercise are fantastic for sleep is that it can help build up adenosine, which is going to make you feel sleepier and help you fall asleep. It's going to be fantastic for helping you get into those deep stages of sleep, which are really important for repairing muscle, repairing tissue, repairing cells. And it's also going to decrease awakenings, not to mention folks who have obstructive sleep apnea and insomnia are also going to get a lot of benefits out of exercise. I hope that you can have the opportunity to look at your schedule and figure out where exercise is going to be there so it can help you sleep, but also it's not going to be a hindrance to your sleep. I'm Leah Kaler, and thank you for watching.